Managing diabetes effectively requires more than just lowering blood sugar. It requires maintaining stable glucose levels safely, consistently, and over the long term. One of the most widely prescribed long-acting insulin therapies in the world is Lantus SoloStar. In today's PharmaFlix professional review, we will explore everything you need to know about Lantus SoloStar, also known as Insulin Glargine U-100. We will discuss its mechanism of action, clinical uses, dosage, pharmacology, administration technique, side effects, precautions, storage requirements, patient counseling points, and important professional clinical pearls. Before discussing Lantus itself, it is important to understand the disease it is designed to treat. Diabetes mellitus is a chronic metabolic disorder characterized by elevated blood glucose levels due to defects in insulin secretion, insulin action, or both. Insulin is a hormone produced by the beta cells of the pancreas. Its primary function is to regulate glucose metabolism and maintain blood sugar within a healthy range. When insulin production becomes insufficient, or when the body becomes resistant to insulin, glucose accumulates in the bloodstream, resulting in hyperglycemia. Persistent hyperglycemia can damage multiple organs and body systems, including the eyes, kidneys, nerves, heart, and blood vessels. There are two major forms of diabetes commonly encountered in clinical practice. Type 1 diabetes mellitus is an autoimmune condition in which pancreatic beta cells are destroyed by the immune system. Patients with type 1 diabetes produce little or no insulin and therefore require lifelong insulin therapy. Type 2 diabetes mellitus, on the other hand, is characterized by insulin resistance and progressive pancreatic dysfunction. Over time, insulin production declines and blood glucose levels rise progressively. In healthy individuals, the pancreas continuously releases small amounts of insulin throughout the day and night. This is known as basal insulin secretion. Basal insulin controls fasting blood glucose levels, suppresses hepatic glucose production, and maintains metabolic stability between meals and during sleep. In diabetes patients, especially those with advanced disease, basal insulin production becomes inadequate. This is where long-acting insulin therapies, such as Lantus SoloStar, become critically important. Lantus SoloStar is a long-acting basal insulin analog containing Insulin Glargine U-100. It is manufactured by Sanofi. https://www.sanofi.com. UTM_source equals chakbit.com, and is designed to provide slow, steady insulin release over approximately 24 hours with minimal peak activity. The medication comes in a disposable pre-filled insulin pen known as the SoloStar pen. Each pen contains 3 milliliters of solution, equivalent to 300 units of insulin. Unlike older vial and syringe systems, the SoloStar pen offers greater convenience, portability, dose accuracy, and ease of administration. These advantages help improve patient adherence to insulin therapy. Insulin glargine differs structurally from regular human insulin due to specific amino acid modifications. These modifications alter its solubility and absorption characteristics. Inside the pen, insulin glargine remains soluble in an acidic solution. However, after subcutaneous injection into the neutral pH environment of body tissues, it forms microprecipitates beneath the skin. These microprecipitates slowly release insulin over time, producing stable and prolonged basal insulin coverage. Lantus lowers blood glucose through several mechanisms. It increases glucose uptake into muscle and fat tissues, suppresses glucose production by the liver, inhibits fat breakdown, and reduces protein catabolism. Together, these actions help maintain stable blood glucose levels throughout the day and night. The onset of action of Lantus is typically 1 to 2 hours after injection. Unlike intermediate-acting insulin, such as NPH insulin, Lantus has minimal or no pronounced peak. Its duration of action is approximately 24 hours, making once-daily administration possible for many patients. Lantus SoloStar is indicated for improving glycemic control in adults and children with type 1 diabetes mellitus and in adults with type 2 diabetes mellitus. In type 1 diabetes, Lantus provides basal insulin coverage and is typically used alongside rapid-acting mealtime insulin. In type 2 diabetes, it may be used alone or in combination with oral anti-diabetic medications and other injectable therapies. To understand Lantus more clearly, it is important to distinguish between basal insulin and bolus insulin. Basal insulin provides background insulin coverage throughout the day and night. Bolus insulin, also known as mealtime insulin, controls blood glucose spikes that occur after meals. Lantus is a basal insulin and is not intended for rapid glucose correction or diabetic ketoacidosis treatment. The dosage of Lantus must always be individualized. There is no universal dose suitable for all patients. Dosing depends on factors such as body weight, insulin sensitivity, diet, physical activity, renal function, liver function, concurrent medications, and blood glucose trends. In many adults with type 2 diabetes, therapy may begin with 10 units once daily or approximately 0.1 to 0.2 units per kilogram per day. Doses are then adjusted gradually based on fasting glucose readings and HbA1c results. Correct administration technique is essential for safe and effective insulin therapy. Lantus is administered subcutaneously into areas such as the abdomen, thigh, or upper arm. Injection sites should always be rotated to reduce the risk of lipodystrophy and inconsistent insulin absorption. Before using the SoloStar pen, patients should inspect the insulin carefully. The solution should appear clear, colorless, and free from particles. A new sterile needle should be attached before every injection. The pen should then be primed according to manufacturer instructions to ensure proper insulin flow. After dialing the prescribed dose, the needle is inserted into the subcutaneous tissue and the injection button is pressed completely. Patients should hold the needle in place for approximately 10 seconds before removal to ensure full dose delivery. Used needles should be discarded safely in an approved sharps container. Proper insulin storage is also extremely important. Unopened pens should be refrigerated between 2 and 8 degrees Celsius and should never be frozen. Pens currently in use may generally be kept at room temperature below 30 degrees Celsius, protected from direct heat and sunlight. Most in-use pens should be discarded after 28 days, even if insulin remains inside. Like all insulin products, Lantus may cause side effects. The most common adverse effect is hypoglycemia, which remains the most significant risk associated with insulin therapy. Symptoms of hypoglycemia include sweating, shakiness, hunger, dizziness, palpitations, irritability, blurred vision, and confusion. Severe hypoglycemia can lead to seizures, unconsciousness, coma, and even death if untreated. Other possible side effects include weight gain, injection site reactions, edema, rash, itching, and lipodystrophy. Some patients may experience localized redness or swelling at injection sites. Repeated injections into the same location may cause fatty tissue changes that interfere with insulin absorption. Lantus may also rarely cause severe allergic reactions, including anaphylaxis. Another important concern is hypokalemia, because insulin drives potassium into cells and may lower serum potassium levels. Severe hypokalemia may increase the risk of dangerous cardiac arrhythmias. Lantus should not be used during episodes of active hypoglycemia or in patients with known hypersensitivity to insulin glargine or any formulation component. It should never be administered intravenously because rapid systemic absorption could produce life-threatening hypoglycemia. Additionally, Lantus should never be mixed or diluted with other insulin products because doing so may alter its pharmacokinetic profile. Several medications may interact with insulin therapy and alter blood glucose control. Drugs that may increase the risk of hypoglycemia include sulfonylureas, ACE inhibitors, salicylates, and alcohol. Medications such as corticosteroids, thiazide diuretics, and sympathomimetics may increase blood glucose levels and reduce insulin effectiveness. Beta blockers may mask symptoms of hypoglycemia, making recognition more difficult for patients. Special caution is required in elderly patients, who often have greater risk of hypoglycemia and impaired renal function. Patients with kidney or liver disease may require dose adjustments because insulin metabolism and clearance may be altered. Pregnancy also requires careful glucose management. Poor glycemic control during pregnancy increases the risk of maternal and fetal complications, including congenital abnormalities, macrosomia, and neonatal hypoglycemia. Insulin therapy remains essential for many pregnant patients with diabetes, although dosing requirements may change significantly throughout pregnancy. Healthcare professionals monitor several important parameters during insulin therapy, including fasting blood glucose, HbA1c, hypoglycemia frequency, body weight, renal function, and injection site condition. HbA1c reflects average blood glucose levels over approximately 2 to 3 months and is an important marker of long-term glycemic control. Patient education remains one of the most important components of successful insulin therapy. Patients should understand proper injection technique, glucose monitoring, insulin storage, dose timing, hypoglycemia recognition, and emergency management strategies. They should also be instructed never to share insulin pens with other individuals due to infection risk. Mild hypoglycemia is commonly treated using fast-acting carbohydrates such as glucose tablets, fruit juice, or regular soda. Patients are often taught the 15-15 rule, which involves consuming 15 grams of carbohydrate and rechecking blood glucose after 15 minutes. Severe hypoglycemia may require glucagon administration or emergency medical assistance. Compared with older basal insulin products such as NPH insulin, Lantus offers several clinical advantages, including more predictable glucose control, reduced nocturnal hypoglycemia risk, and once-daily dosing convenience. However, newer ultra-long-acting insulins, such as insulin degludec, may provide even longer duration and greater dosing flexibility in some patients. Common clinical errors with insulin therapy include missed doses, inconsistent injection timing, improper storage, and repeated needle reuse. Patients should be counseled carefully to minimize these risks. Proper insulin therapy helps reduce the risk of diabetes-related complications, including diabetic retinopathy, nephropathy, neuropathy, cardiovascular disease, stroke, and peripheral vascular disease. However, insulin works best when combined with healthy lifestyle habits such as balanced nutrition, regular physical activity, smoking cessation, and weight management. Lantus SoloStar continues to play a major role in modern diabetes management because of its reliable basal insulin coverage, predictable pharmacologic profile, and convenient pen delivery system. When used correctly alongside appropriate monitoring and patient education, it can significantly improve glycemic control and help reduce the long-term complications of diabetes mellitus. This educational content is intended for informational purposes only and should not replace professional medical advice, diagnosis, or treatment. Patients should always consult a qualified healthcare professional before starting, stopping, or changing any medication or diabetes treatment plan. My name is Ijaz Ahmad, and you were watching PharmaFlix. Allah Hafiz.